Okay, so hopefully you had a little break, got a snack, hydrate, because we're coming back to muscles of the trunk, and we're gonna knock this out, and that will be it for the axial musculature. So let's start with our muscles of the anterior abdominal wall. Anterior abdominal. Okay. So likely you've heard a lot of these terms before. Many people know rectus abdominis as our six-pack muscle. We've likely heard the terms obliques. A lot of times people want to strengthen their obliques to get that nice V in their abs for aesthetics. So these are a lot of terms that people know more colloquially. And now we're going to talk about these different layers and how they create specific motions within the abdominal region. So first off, let's talk about that rectus abdominis. That is going to be the most superficial muscle we see, this guy. So the right-hand side, the rectus sheath has been removed. What you see, this white part on the left side here that I'm circling right now, that is a sheath of connective tissue with, it's basically got different connective tissue from all the abdominal muscles running together to create this sheath to help protect our muscles and increase intra-abdominal pressure. So that is not information you need to know. We're going to focus on the right side, or from anatomical position, it would be left side, this view. Okay. So rectus abdominis, it gets the term six-pack from these structures here, which are called tendinous insertions. And they're literally just tendons that are helping to break up our rectus abdominis. Let's write that term over here, so make sure you know that for the lab exam. I could ask you rectus abdominis, I could ask tendinous insertion. And what they're doing is they're breaking up the muscle. So if we didn't have these tendinous insertions, it would be a lot harder to flex our torso, such as during a sit-up. By having these insertions, they almost act like a pulley system, kind of like our patella in our thigh, to help further flex the torso. So these tendinous insertions are part of why we can do sit-ups and crunches all day long. And they're also what helps create that six-pack. So everybody technically has a six-pack. Some of us just have more or less fat in the abdominal region covering it up. And that's just natural human variation. Okay, so make sure you know those tendinous insertions. Let's talk about muscle action. So these muscles are just running straight up and down. And so when they contract, what happens is the torso is going to flex. Shortened muscles means torso is going to go in the direction of those shortened muscles. And that's what allows us to do sit-ups. Let's get that out of the way now. Next up, we have our obliques. So we actually have two types of obliques. We have external and internal abdominal obliques. Make sure we write that in here. So on a lab exam, yes, I will know what you're talking about if you say external or internal obliques. But we want to make sure we're getting all parts of the word here. Three parts: external or internal abdominal obliques. These are another superficial group. So they are both going to help with flexion and rotation of the trunk. So here's another shared action. When you're making flashcards, or however you want to study, make sure you're grouping them by the same action here. They do have different fiber orientations. So external obliques are going to run inferiorly in the same direction as if you were putting your hands in your pockets. So I can try to draw that here. They're going to run in this direction. Internal obliques are the opposite. They're going to run superiorly. So if you put your hands up in a Y shape, like the YMCA dance, that is the direction that these fibers are going to be running. And then lastly, we have our transverse abdominals. Transverse abdominis. This one is a little trickier to see on our model, so that's a good clue that it's not going to be a good candidate for the lab exam. But these muscles run in a transverse direction, so they're going to run crosswise, and they are going to help with mainly lateral rotation of the trunk. And that makes sense if we think about the direction. They're running transversely, so when they shorten, we're going to rotate one way or the other. And that is it for the abdominals we could ask on the exam. There's a couple other structures here. So we did talk about tendinous insertions, but we haven't talked about this line here. That line is going to be our linea alba, a white line. And so this guy is running all the way from our xiphoid process to the pubis, and it's going to be an attachment point for a lot of our muscles. So it's going to be an attachment for the obliques and for the transverse abdominis. So that's also a good lab exam candidate for the test. We have some additional muscles, so we've got external and internal intercostals, and then our innermost intercostals. So I don't have an image for this one because we can't find them. We can't really find them on our models, so it's not testable for the lab exam, but it is a good candidate for lecture. So what we're going to do is we're going to sketch out just a pair of ribs here, and then I'm going to show you the relationship between these guys. That's rib 1 and rib 2. So what we're looking at is 2 pairs of right ribs. And let's go ahead and write out our muscle names here. So we've got external intercostals. We're going to have internal intercostals. And then we'll have our innermost intercostals. So this might show up in lecture. So if we're talking about deep muscles of the abdomen that are having a relationship with the ribs, we're going to use this term intercostals because these muscle fibers run between the ribs. And the other term here, external, internal, innermost, refers to the orientation of the fiber and the deepness of the fiber. So the most superficial one we see is going to be our external intercostals. So they're going to run in that same pattern we see with the external abdominal obliques. They're running like hands towards our pockets. Internal intercostals have the opposite direction, and they're going to be a little deeper here. So that term internal, external can refer to fiber direction. That can help you. Or you can think about how external is more superficial. Internal is going to be a little deeper. And then lastly, we have this straight up and down muscle fiber, which is going to be our innermost intercostals, deepest. So I recommend doing a sketch like this just to help remind yourself. And basically these are all involved in respiration, breathing. So our external intercostals are going to help with exhalation when we release a breath, either forcefully or naturally. Internal intercostals, they're going to help depress the ribs. So when they contract, they're going to run in this direction, depressing the top rib towards the lower one, which is opposite of what the external intercostals are going to do. And so when we depress the ribs, that's going to help us to kind of decrease the volume. If you think about squeezing your rib cage, what happens is we're going to help squeeze air out. And so that's another case where they're going to help with exhalation. Okay. And then our innermost intercostals are another exhalation one. I think I got my terms mixed up here. So, come back. So this guy, external intercostals, I mixed up my X's here. External intercostals, if we think about the way that the ribs are going to be contracting, the lower rib is going to be pulled towards the upper rib. So what's happening is it's going to elevate the ribs. Think about when we inhale, our chest expands. So external intercostals are helping with inhalation. Wrote the wrong term there. So just to be clear, external intercostals are inhalation, internal contracting in the opposite way, so that's going to be exhalation. So both of our muscles that start with an I here, internal intercostals and innermost intercostals, are going to help with exhalation. So I just got those mixed up. It's a tricky one to understand, so make sure you know these concepts really well for lecture. But they are not going to be tested on the lab exam. Okay, not going to talk about the diaphragm, so hopefully we all know the diaphragm is an important muscle for respiration. When it's contracting, it's going to kind of expand our volume of our chest to help pull air into our lungs. When it relaxes, it's going to do the opposite and help push air out. So that's a good one to know, but I'm not going to test you on it. So let's get into the back now. We're going to start with superficial back. And some of these muscles you see are going to pop up again with the appendicular skeleton. So just be aware of information coming from both labs for the same kinds of muscles. So first up we have our trapezius. So let's scroll down here just a little bit, or up perhaps. There we go. Yep, so I'm going to clear this out of the way. So trapezius is one of those that is acting on the neck, and it's acting on the back, and it's going to have some actions in the arm that we'll talk about next lab. So a lot of these back muscles, they're really broad and they have multiple attachment points. So they're going to have actions within different regions. So trapezius, when you see the term trapezius, think trapezoid. So it's a trapezoid shaped muscle, kind of diamond shaped. It's going to go from all the way from our head to the shoulder or the scapula. And then we're going to form this diamond shape. So it has attachment points all along our cervical and our thoracic vertebrae, and it's also going to have an attachment point on the scapula. And what it's going to do because of that is it has fibers in many different directions. We're going to have multiple action points. So it's going to have actions on the scapula. So let's go ahead and draw some of the fibers here. The more secure attachment point here is along the thoracic and the cervical vertebrae. So when this muscle contracts, it's going to do things like rotate the scapula, retract them. We can elevate. So we have muscle fibers a little more superiorly that are going to help elevate our scapula. Retraction, as we talked about, is where we're trying to squeeze our shoulder blades together. So that would be more like this middle arrow here, if we think about muscle fiber direction. And then it's also going to help depress the scapula, which makes sense because, again, we've got these fibers running inferiorly. When these fibers contract, they're going to help pull the scapula down. So depending on where most of the force is coming from, which fibers are working harder, that's going to affect the action of the scapula. Next up, we have latissimus dorsi. So if you see the term dorsum, that just refers to back. So we'll have dorsal this, dorsi that. All of that refers to this back region. Latissimus dorsi is the other main superficial muscle of our back, and it's super broad, so it's going to have a ton of different attachment points. So I'm kind of outlining it here. This fan-shaped muscle that's going to go underneath our trapezius, and it has these attachment points along the lumbar and the sacrum. So originally, it's going to originate from basically T7 through L5. So most of our thoracic and then our lumbar vertebrae here. This white part you see is our thoracic lumbar fascia. So this is a broad expansive fascia that the muscle fibers are going to run into, and then this fascia will expand all the way down to our iliac crest. So kind of outlining some of those broad attachment points. All of these are going to be secure attachment points. So these are going to be our origins. And so the muscle, when it contracts, is going to be going towards the vertebrae, towards that lumbosacral region, towards the iliac crest. And because of that, some actions are going to help with things like expiration, breathing. And then another really cool thing about this muscle is that when our arms are fixed, when our arms are in a position where they are not going to move, such as when we are climbing or rowing, so think about rock climbing, this muscle is really important to help pull our trunk up and forward. So you may have heard the term lat pull down. That's a really popular exercise for strengthening of the lat. So anything where our arms are overhead and they are not going to move, we can use this latissimus dorsi to help pull our trunk up and forward. And we'll talk a little more about that next lab. Okay, we have a couple superficial muscles in the head and neck region. Let's get this out of the way. These are less likely to be tested on the exam, but I'll just point them out, make sure we covered them. And they're going to be, so we're going to go back to that splenius term from the posterior triangle. So this is a case where we talked about it in the neck. We're going to talk a little bit about it in the superficial back. So splenius has two heads, technically, that are going to connect to our occipital bone here. And then they're going to have some attachments in the vertebrae. So the heads are splenius capitis and cervicis. So if we had to take an educated guess, our splenius cervicis is going to be our muscle that is attaching to the cervical vertebrae, maybe a little lower, and then our splenius capitis is going to be a little more superior. It's the one that's going to have a head attachment, so to speak. So those are not very well separated on our model, so I'm just going to outline them for you. If you call this muscle splenius on the exam, that would be full credit, just because it's a little unfair to try to ask you to separate the two heads when they're not super defined on our models. So we can just barely see the separation here towards the cervical vertebrae. We also have a semispinalis. So if we stripped these muscles back, we would have a deeper region where we've got one more muscle that rotates the head and neck. I'm not going to write it down because I don't want you to worry about it. So the main things to know for superficial posterior neck and back would be splenius up top, trapezius, and latissimus dorsi. And then lastly, we have our rhomboids. So we have to use the left side of our model for the rhomboids because they're a little deeper. And rhomboids, if you think about rhombus, that's kind of another trapezoid shape. Those are the kind of blocky muscle that we see here, outlined in pink. So these are going to be our rhomboid major and minor. These are based on the size of the muscle. So major is going to be larger. It's also a little inferior. So I'm going to draw a line here between our major and our minor. Okay, so the smaller muscle, more superior, is going to be minor. And then the muscle that's more inferior, this guy, is rhomboid major. And these are going to help adductor scapula or retractor scapula. So again, we're trying to squeeze the shoulder blades together towards that midline. So these terms can be used interchangeably: scapular adduction or scapular retraction, retracting towards the midline. Okay, that is everything in the superficial back. We're going to quickly go through some deeper muscles, and then we will finish off with our iliopsoas. So we are almost there. The erector spinae muscles will pop up in lecture, I can promise you that. So I want to make sure we cover them, but I'm not going to ask them to you on a lab exam because we don't have a great view of them from our models. So just for reference, most of our questions for the lab exam for muscles are going to be superficial muscles. One, because I only have 30 minutes to set up the exam, so I'm not going to spend time digging around for the really deep muscles. And number two, these are just the muscles that we have the best view of. Deep muscles are harder to see. Sometimes they're not clearly defined on our models. So when you're studying, definitely want to emphasize superficial muscles. Okay, so back to it. For the erector spinae muscles, from the name, we know this is going to help erect our spine, or in other terms, extend our vertebral column. And there are 3 of them. I believe Dr. Yard uses "I like spaghetti" to remember them, and that's what stuck with me, so we're going to use it here. So I like spaghetti refers to iliocostalis, longissimus, and then spinalis. And these run lateral to medial. Let's write that in here. And if we break down these terms, this makes sense. So iliocostalis is going to be most lateral. It's associated with our ribs and our ilium. So although they're not pictured on this model, we can kind of imagine where they would be. Iliocostalis is going to be closest to our vertebral column, running from the level of our ilium up to our ribs. And these are, all three of these are going to go all the way from our occipital bone all the way down to the sacrum. The middle muscle is a longissimus muscle. There's not much to tell this apart, only knowing that it's in the middle. And then the other one is spinalis. And so spinalis is going to be the most medial, closest to our spine.